Hi, I'm Dr. Zagum Bhatti, Managing Physician of Modern Vascular of Houston, and I'll be talking to you today about the right questions, the right treatment, critical questions that you as a patient should discuss with your doctor. I want to start by discussing peripheral and coronary artery disease and their association. These should really be considered two sides of the same coin. Coronary artery disease remains the greatest cause of morbidity and mortality in the US, with upwards of 40% of patients with coronary artery disease also having peripheral arterial disease. And as PAD affects an estimated 200 million people worldwide, a substantial portion of the population has both conditions. And that indeed is borne out in studies. In patients with clinically significant PAD, the prevalence of myocardial infarction is 2.5 times higher than in those patients without PAD. Clinically significant PAD is defined as an ABI, or ankle brachial index, less than 0.9. Symptomatic PAD has been associated with a 70% risk of increased risk of cardiovascular events and an 80% increased risk of death when compared to patients without PAD. And so, given this knowledge, what should patients do? Well, get checked out. If you think you may have PAD, or if you're exhibiting signs and symptoms of PAD, or if a doctor has told you that you have PAD on the basis of a physical exam or testing, see a cardiologist to determine if you have coronary artery disease. Likewise, if you have known coronary artery disease, seek out a physician who specializes in the diagnosis and treatment of PAD, because early detection could save you a lot of trouble down the road. I highlighted some stats regarding the association of PAD and CAD in the last slide. Patients with PAD also tend to have more complex coronary artery disease. Therefore, mitigating the effect of atherosclerotic disease following the identification of clinical or subclinical PAD really centers on aggressive risk factor modification. So this means addressing the controllable factors which contribute to atherosclerotic disease, and those being smoking cessation, management of high blood pressure, management of hypertension, managing cholesterol and diabetes. Additional interventions may include antiplatelet or statin therapy to reduce both cardiac and peripheral arterial adverse events. Finally, be attuned to your health. If you start feeling new leg cramps, don't just attribute it to old age or muscle soreness. Seek consultation as soon as you can, as it could be a sign of PAD. Now let's talk about choosing the right doctor. I know that when it comes to choosing the right doctor, that can be a pretty daunting task. Of course, your insurance plan may restrict your choices to a group of plan-approved doctors or offer incentives to use plan-affiliated doctors. But even so, these are questions you will want to think about when you're selecting a doctor. The first is, how many years of experience does your doctor have, the doctor you're considering have? There are many different types of physicians with different specialties who operate in this space of vascular care. Those physicians being interventional cardiologists, vascular surgeons, interventional radiologists. Physicians have differing levels of training and post-training experience in treating vascular disorders. And contrary to popular belief, it is not necessarily the doctor at the biggest name facility or with the most publications who is best. So what is the doctor's skill set? How many procedures have they done? Can they revascularize arteries to the level of the foot or just above the knee? What is their general approach or philosophy to treatment? Are they using the best tools and techniques associated with the best outcomes? These are all things that need to be considered. Another question I urge you to ask is, how long do you have to wait for an appointment after you call? Can you be seen on the same day if you have an urgent need? Or will the practice simply tell you to go to the ER and have another physician deal with an acute problem you are facing? This is an important thing to know. Is the office staff friendly and courteous? I believe that this speaks to the overall culture of the practice and of the physician, and whether the practice has adopted a patient-centric approach to care. Who covers for the doctor when they are away? Who should you call if there's a problem that occurs after hours? If the doctor works in a group, are you comfortable with being seen with one of the other practice partners? How often will you see the doctor for your problem? This is especially important in practices where procedures are performed. You want to ensure that you are not just to undergo a procedure and then, for lack of a better term, be abandoned by that practice and left to be managed by your primary care doctor. You should be scheduled at regular intervals for appropriate follow-up and for guidance. In order to effectively treat this disease process, good longitudinal care is really essential. And finally, arrive prepared for your appointment. When you meet with a doctor you've selected, it's best to go into your appointment armed with a list of questions, as well as your medical history, any tests you've undergone, imaging studies, a list of your current medications. Ask as many questions as you have and consider how the doctor receives you. If he or she doesn't seem to be listening or taking your concerns seriously, this might not be the right fit for you, and it may be worth trying to find another doctor. If you still aren't sure about your choice, ask if you can make an interview appointment to speak with the doctor about your concerns. You may have to pay a copay or other fee for the service, but it can be a very valuable way to gather information when making this decision. Let's talk about questions you should ask your doctor. So once you've selected your doctor, I think there are some important questions you should ask as you embark on your treatment plan. The first question I would consider asking is, will conservative therapies help my condition? Surgeries or even minimally invasive procedures can come with the risk of complication. And so it's worth asking if you really need a surgery or a procedure. For example, many PAD patients can see a relief in their symptoms simply by adhering to an exercise regimen. In addition to promoting the formation of alternative arterial pathways, it can lower many risk factors for atherosclerosis, such as modifying LDL, hypertension, contributing to weight loss. For those suffering with claudication or pain with exertion, it's been proven that exercise alone can improve the distances you can comfortably walk. Should you need an intervention, are there alternatives to surgery? Surgery isn't the only option for patients suffering from PAD. There are also minimally invasive procedures to consider. There's atherectomy, angioplasty, stent placement, all of which you've heard about today. These come with significantly reduced recovery time and less potential for complications. You should know that should you require a procedure for your PAD, you can now return to your home and to your family the same day after undergoing a cutting-edge and minimally invasive vascular procedure. Do I have to undergo amputation? The answer is no. For many patients presenting with severe PAD with leg or foot ulcerations or even gangrene, modern day treatments can save the patient from undergoing an amputation in almost 80% of cases. So it's important for you to know that. Can I reduce or reverse my risk of developing significant PAD? This is really, I think, where the most important work is done to influence the trajectory of disease. Staying active, maintaining a healthy weight can lower your risk for diabetes, heart disease, and PAD. This can be true even if you have a family history of PAD or if you have experienced health problems in the past. Smoking cessation is also highly recommended for those at risk for developing PAD or for those who already have PAD. If I have to undergo a surgery or a procedure, what is a long-term game plan for my care? Again, this is a disease process which requires constant vigilance and follow-up. Your doctor and his or her team needs to see you regularly to ensure that you are adhering to a proper diet, that you are controlling your diabetes, that you are getting sufficient exercise, and also doing a regular physical exam to ensure no new problems are developing. I want to talk about a couple of additional important factors to consider. Never agree to an amputation without first undergoing an arterial evaluation. It is absolutely critical that an arterial evaluation be done first. In about 80% of cases, major amputation can be prevented with an angiogram and a procedure called a revascularization. After an amputation, many patients will never walk again, which will worsen PAD and result in a vicious cycle. Additionally, almost half of all patients who undergo major amputation are deceased after 1 year. undergoing major amputation actually carries a worse prognosis when compared to many cancer diagnoses. Another important factor when selecting and speaking with your doctor to consider is, does your doctor have experience in treating arteries to the level of the toes? This is so important, but unfortunately simply not being done by the vast majority of vascular specialists. If the appropriate arteries are not treated, meaning if those smaller arteries below the level of the knee and in the foot, which are typically harder to treat, are not actually treated, the chances of getting the desired clinical outcome is significantly reduced. And furthermore, there is a high risk of symptoms returning sooner. Vascular care has improved tremendously in just the past few decades. Vascular disease can be effectively managed with risk factor modification and medical therapy. However, if you have to undergo a procedure, you can now undergo a cutting-edge, minimally invasive procedure to effectively treat your disease and allow you to be home the same day. When recognized, many physicians are actually not aware of some of the newer treatment options that are out there and available for patients. And this highlights the importance of consulting with a specialist. And we talked about some of the things to look for in a doctor. Finally, given the complex nature of this disease process, it is important to stay vigilant and also to be your own advocate as you set out on your journey. If something doesn't make sense, don't be afraid to ask questions. Don't be afraid to seek out a second opinion. Fight for your life and for your limb. Be your own advocate. Thank you very much. It was a pleasure speaking with you today. If you have any questions, please feel free to reach out, and my email address is provided there. Thank you so much.